السلام عليكم ورحمة الله وبركاته طلاب المرحلة الرابعة. وياكم المدرس المساعد نور وفاء هاشم. نعطيكم اليوم مختبر non-steroidal anti-inflammatory drugs. الدراجات المطلوبة في هذا المختبر دايكلوفيناك، بوتاسيوم and sodium, also indomethacin, meloxicam, piroxicam and selective COX-2 inhibitor etoricoxib. أول واحد راح نتكلم عنه اليوم هو دايكلوفيناك بوتاسيوم. كإنديكيشن and dose used for treatment of pain and inflammation in rheumatic disease and other musculoskeletal disorders. الدوز من الأعمار اللي تبدي من 14 إلى 17 سنة، تكون بين 75 إلى 100 ملغرام daily in 2 to 3 divided doses. while in adults الدوز تكون 75 إلى 150 also in divided doses. Diclofenac potassium أيضا يستخدم treatment of acute gout and post-operative pain, migraine and fever in ear, nose and throat infection. والاستخدامات والدوزات موجودة عندكم هنا، كلها أنا ثبتت لكم إياها حتى تعرفوها. Unlicensed use Diclofenac potassium unlicensed use for children under 14 years of age. Contraindication بشكل عام كل non-steroidal anti-inflammatory drugs contraindicated in patients with active gastrointestinal bleeding and gastrointestinal ulceration, also in cerebrovascular disease or history of gastrointestinal bleeding related to previous NSAID therapy, history of gastrointestinal perforation because of non-steroidal therapy. يعني بشكل عام كل البليدنج الهيستوري اوف بيبتيك ألسر history of GIT bleeding بسبب بيبتيك ألسر previous بيبتيك ألسر أو previous non-steroidal anti-inflammatory use. cautions يعني تستخدم بحذر عند المرضى اللي يصير عندهم allergic disorders or cardiac impairment because of non-steroidal anti-inflammatory drugs may impair renal function فيستخدم بحذر عند دول الأشخاص. Also in patient with coagulation effect or connective tissue disorders, in patient with Crohn's disease because it may be exacerbated. Also in elderly, history of cardiac failure, hypertension, left ventricular dysfunction, edema and risk of factor for cardiovascular events, ulcerative colitis also may be exacerbated. Interaction for non-steroidal anti-inflammatory drugs. Please return to Appendix 1 in your textbook BNF. ترجعون بالكتاب إلى القسم الخاص بالأبندكس اللي هو الانتراكشن، وتشوفون الميجر interaction or severe interaction بين non-steroidals والother drugs. كside effects إحنا ننتبه طبعا على common or very common side effects. ويا diclofenac potassium appetite decrease or diarrhea, dizziness, GIT discomfort, GIT disorders, and maybe nausea, vomiting, vertigo, and skin reactions. هذه صورة الدايكلوفيناك بوتاسيوم بتراكيز 25 و 50 ملغرام. Allergy and cross sensitivity contraindicated in patients with a history of hypersensitivity to aspirin or any other non-steroidal. بشكل عام أي واحد من non-steroidal should be contraindicated، ما يصير ينصرف نهائيا للمرضى أو للأشخاص اللي عندهم any history of hypersensitivity to aspirin أو any other drug of a non-steroidal. Also in whom attack of asthma, angioedema, urticaria or rhinitis have been precipitated by aspirin and other NSAID. Use of non-steroidal for long term in females may reduce fertility. Also use of non-steroidal خصوصا الدايكلوفيناك potassium in pregnancy avoid unless the potential benefits outweigh the risk. هنا القرار يرجع للطبيبة الأخصائية هل ممكن ينصرف أو لا. Especially should be avoided during the third trimester because of risk of closure of fetal ductus arteriosus. Also, non-steroidal خصوصا diclofenac may onset of labor may be delayed and duration may be increased. during labor، هذا راح يأثر على الولادة. استخدام أيضا بالبريست feeding used with caution during breastfeeding. Amount of diclofenac may be found in small amount and small to be harmful. In hepatic impairment, manufacturer advise caution in mild to moderate impairment and avoid in severe cases. Renal impairment, avoid if possible or use with caution and should be avoided in severe impairment. Dosage adjustment. The lowest effective dose should be used for shortest possible duration. Also, monitoring in renal impairment patient should be monitored renal function, sodium and water retention, because sodium and water retention may be occur and the renal function may be deteriorated and may be possibly leading to renal failure. As a medicinal form, tablet available at a dose of 25 and 50 milligram، تراكيز 25 و 50 ملغرام. And follow a cautionary and advisory label 21 اللي تقول take with or just after food or a meal. الدرج الآخر هو دايكلوفيناك صوديوم، هو دايكلوفيناك لكن بشكل ملح الصوديوم. أيضا نفس الإنديكيشن of دايكلوفيناك بوتاسيوم اللي هو for pain and inflammation in musculoskeletal disorder، أيضا بالacute gout، بالpain and inflammation rheumatic disease including juvenile idiopathic arthritis. Also كtreatment of post-operative pain. الدرج available قد يكون بتركيز اللي هو دايكلوماكس ريتارد اللي يكون بشكل ريتارد، هذا يؤخذ كبسولة واحدة باليوم. وإذا كان sustained release ممكن يؤخذ بشكل وحدة كبسولة واحدة إلى 2 باليوم. وإذا بشكل آخر اللي هو موتيفين قد يكون ممكن يستخدم أيضا مرة إلى مرتين باليوم. هذه أسماء تجارية لكن هو كله نفس الاسم العلمي اللي هو دايكلوفيناك صوديوم. وأيضا موجود بشكل تابلت sustained release بتركيز 75 ملغرام، يؤخذ واحدة إلى 2 باليوم. وأيضا موجود بشكل imagel as for treatment of topical apply 3 to 4 times per day and therapy should be reviewed after 14 days. أما treatment of osteoarthritis ممكن يستمر حتى 28 يوم. Also voltarol اللي هو retard يستخدم أيضا for treatment of pain and inflammation. Also treatment of acute gout and post-operative pain may be used 1 tablet once daily. يعني بشكل عام الريتارد يستخدم مرة واحدة باليوم، والsustained release ممكن مرة إلى مرتين. أيضا متوفر بشكل solution for injection، يستخدم بشكل أمبولات موجود بالصيدليات بتركيز 75 ملغرام. هذه تؤخذ واحدة إلى 2 باليوم، يعني maximum 2 ampule per day، maximum 150 ملغرام per day for maximum of 2 days، يعني مسموح له ياخذ باليوم الواحد 150 ملغرام ومو أكثر من يومين. أيضا يستخدم for treatment of ureteric colic by deep IM injection بتركيز 75 ملغرام may be repeated after 30 minutes if required. and treatment of acute post-operative pain خصوصا بعد العمليات ينطونه، ممكن يستخدم intravenously أو حتى أو يستخدم intramuscularly بتركيز 75 ملغرام، وممكن بعد 4 إلى 6 ساعات 75 ملغرام maximum per day 150 ملغرام. أيضا يستخدم prevention of post-operative pain in hospital setting مثل ما قلنا. ممكن يستخدم طبعا هذا under specialized supervision خصوصا ال IV initially 25 إلى 50 ملغرام to be given after surgery over 50 to 60 minutes and the dose may be repeated and not more than 150 ملغرام per day. Contraindication with عندنا 2 contraindication with IV use and with systemic use. With IV use contraindication if the patient is dehydrated or have history of asthma, history of confirmed or suspected cerebrovascular bleeding, a history of hemorrhagic diathesis, hypovolemia, operation with high risk of hemorrhage, any history of hemorrhage. While with systemic use, active GIT bleeding or active GIT ulceration, and avoid suppository in bronchitis and used contraindicated in CVA or congestive heart failure or GIT bleeding and other GIT because of a previous NSAID history and history of recurrent GIT hemorrhage and history of recurrent GIT ulceration by 2 or more disconnected episodes, and for the patient with ischemic heart disease and peripheral arterial diseases. Used with caution for patients with allergic disorders, cardiac impairment, coagulation defects, connective tissue defects, Crohn's disease, elderly and history of cardiac failure, or for patients with hypertension, left ventricular dysfunction, edema and risk factors for cardiovascular events, and also on patients with ulcerative colitis because this disease may be exacerbated. While the treatment with topical use should be cautioned about avoid contact with eyes, avoid contact with inflamed or broken skin, and avoid contact with the mucous membranes, not for use with occlusive dressing or topical application of large amount can be result in systemic effect. So the amount should be used thinly يعني يستخدم بطبقة جدا خفيفة. أيضا يعني وإذا استخدم كميات كبيرة ممكن يسبب systemic effect. Side effect of diclofenac the common and or very common with systemic use appetite decrease يعني يسوي أنوركسيا فقدان الشهية diarrhea dizziness GIT discomfort nausea skin reaction vertigo or vomiting. While with topical use ممكن يسبب conjunctivitis muscle tone increased edema rash هنا temporarily مؤقت sensation abnormal skin reaction or skin ulcer. مثل ما قلنا any topical application for large amount may be absorbed and give a systemic effect. Allergy and cross sensitivity. Any patient have a history of hypersensitivity to aspirin or other non-steroidal anti-inflammatory drugs may have هنا allergy or cross sensitivity. واستخدام الدايكلوفيناك sodium for long-term use of non-steroidal خصوصا in female patients may decrease fertility. بالpregnancy هنا avoid unless potential outweighs the risk. أما التوبيكال يوز أيضا يعني يفضل استبعاده أو عدم استخدامه خلال فترة الحمل. بالبريست feeding used with caution because amount الكمية قليلة موجودة بالملك بالنسبة للnursing mother should be used with caution. Hepatic impairment. Manufacturer advise caution in mild to moderate impairment and they should be avoided in severe impairment. While in renal impairment, avoid if possible or use with caution and also should be contraindicated or avoided in severe impairment. With IV use, بالنسبة للrenal impairment patient, avoid IV use if serum creatinine greater than 160 micromole per liter and contraindicated in moderate to severe renal impairment. Dose adjustment. With systemic use, the lowest effective dose should be used for shorter possible duration of treatment. Monitoring with systemic use in renal impairment patient should monitor renal function. Renal function test اللي هي اليوريا والكرياتينين should be monitored regularly and sodium and water retention also may occur and renal function may be deteriorated and may be possibly leading to renal failure. Diclofenac sodium موجود بشكل gastro-resistant tablet. Follow cautionary and advisory label 5 أو 25. دايكلوفيناك موجود بشكل تراكيز 25 و50 وسبوسيتاريز موجود بشكل تراكيز 112.5 و25 و50 و100 ملغرام. أيضا موجود بالصيدليات بشكل جل يستخدم توبيكالي. اندوميثاتين هو واحد من الدراجات non-steroidal anti-inflammatory drugs used for treatment of pain and moderate to severe inflammation in rheumatic disease and other musculoskeletal disorders. يستخدم بتراكيز من 50 إلى 200 ملغ daily in divided doses، يا إما using by mouth or used by suppository. أيضا يستخدم treatment for acute gout and dysmenorrhea. Contraindicated in any patient have history of GIT bleeding, and used with caution with any patient have allergic disorders or cardiac problem or connective tissue problem, and a patient with epilepsy, heart failure, ischemic heart disease, Parkinson's, peripheral arterial disease, psychiatric disturbances, risk factor for cardiovascular events, ulcerative colitis may be exacerbated and should be used with caution in uncontrolled hypertension. Specific caution with rectal use: avoid rectal administration in hemorrhoids and avoid rectal administration in bronchitis. Side effect: general side effect. اندوميثاسين له general side effect كبير جدا، وتقريبا كل السيستمز أنا هنا ذاكرتها كلها هاي موجودة بكتاب الBNF، كلها تقريبا السيستمز صار بيها الديفكت أو ممكن يصير side effect بيها، يعني ممكن كلها تظهر أو ممكن جزء منها حسب البيشنت ريسبونس. أما specific side effect هذا بس ويا الأورال يوز يصير ديسبنيا، ممكن ماليز، pulmonary edema or sigmoid lesion perforation. مثل ما قلنا ويا كل non-steroidal anti-inflammatory drugs الالرجي والكروس sensitivity موجودة في أي patient عنده history of hypersensitivity to aspirin or any other non-steroidal ممكن يصير ويا non-steroidal الآخر. وقلنا long term use in female patient may reduce the fertility. وبالنسبة لل pregnant women avoid unless potential benefits outweigh the risk. Breastfeeding women amount probably too small to be harmful. Manufacturer advise avoid unless used with caution during breastfeeding، يعني ممكن تستخدم إذا كانت الأم تحتاجه وحسب ما يعني تنصحها الطبيبة. بالنسبة للبيشنتس اللي عندهم hepatic impairment also used with caution because there is an increased risk of GIT bleeding and fluid retention. Avoid in severe liver disease. Renal impairment, avoid if possible or use with caution and avoid in severe impairment. Dosage adjustment, use the lowest effective dose with the lowest or shortest possible duration of treatment. Monitoring in renal impairment patients يعني monitor renal function tests. Sodium and water retention may also occur and renal function tests may be deteriorated and possibly leading to renal failure. Monitoring required during prolonged period of treatment. Ophthalmic and blood examinations particularly advisable. Patient and care advice: driving and skill task dizziness may affect performance or skill task. يعني هنا البيشنت اللي ياخذه ننصحه إنه ما يسوق عجلات أو سيارات أو هذه ما يؤدي أي driving skills، يعني ممكن يصير عنده dizziness، عنده ميثاسين. medicinal forms اللي متوفرة بشكل suppositories بتركيز 100 ملغ or modified release capsule. هنا follow cautionary and advisory label 21 و 25. خليت لكم إياها أني 21 إنه take this drug with or just after food or a meal and اللي تتبع رقم 25 إنه swallow this medicine whole, do not chew or crush. متوفر بشكل اندوميثاسين modified release capsule بتركيز 75 ملغ وبشكل كبسول عادي بتراكيز 25 و 50. هذا الاندوميثاسين بتراكيز مختلفة. الآن راح نتكلم عن الميلوكسيكام كإنديكيشن and dose. طبعا هو من non-steroidal anti-inflammatory drugs used for treatment of exacerbation of osteoarthritis, pain and also in pain and inflammation in rheumatic disease أو ankylosing spondylitis ويستخدم أيضا for relief of pain and inflammation in juvenile idiopathic arthritis or other musculoskeletal disorders in patients intolerant to other non-steroidal drugs. Meloxicam, unlicensed use for children under 16 years of age. Contraindicated in any patient with a history of GIT bleeding, and also used in caution when patients with allergic disorder, cerebrovascular disease, cardiac disease, connective tissue disorders, Crohn's disease, and elderly. Side effect of meloxicam, common or very common: constipation, diarrhea, GIT discomfort, GIT disorders, headache, nausea, and vomiting. مثل ما كل non-steroidal have a cross-sensitivity. Any patient have a history of hypersensitivity to aspirin or other non-steroidal anti-inflammatory drugs may have cross-sensitivity with others, so it should be contraindicated. Conception and contraception used with caution because long-term treatments with NSAIDs may reduce female infertility, and it's reversible on stopping treatment. Pregnancy should be avoided unless potential benefit outweighs the risk. The breastfeeding used with caution because it's present in milk in animal studies, so manufacturer advise avoid. Hepatic impairment, manufacturer advise caution in mild to moderate cases and avoid in severe impairment. While in renal impairment, avoid if possible or use with caution. If the adult avoid if estimated GFR less than 25 مليلتر per minute بكل 1.73 square meter, while in children avoid if estimated GFR less than 25. Dose adjustment. The lowest effective dose should be used for shortest possible duration and monitoring for renal function tests because sodium and water retention may occur and may deteriorate renal function, so it may be possibly leading to renal failure. Medicinal forms of meloxicam include oral dispersible tablets بتركيز 7.5 إلى 15 ملغ، وأيضا بتابلت عادي اللي يكون تركيزه أيضا 7.5 إلى 15 ملغ. تابلت follow cautionary and advisory label 21 يقول take it with or just after food or a meal. Now we will talk about piroxicam. Indication and dose. Also, it is similar to meloxicam. It's used for treatment of rheumatoid arthritis. It should be initiated by a specialist, and treatment of osteoarthritis, ankylosing spondylitis, used by mouth up to 20 mg once daily. Also, it's used for pain relief in musculoskeletal disorders and treatment in knee or hand osteoarthritis. Also, may be applied to the skin 3 to 4 times daily بتركيز 0.5% gel and review treatment after 4 weeks. Piroxicam have most important safety information. With systemic use, the CHMP recommended restriction on the use of piroxicam because of increased risk of GIT side effects and serious skin reaction. And CHMP advised that piroxicam should be initiated only by a physician experienced in treating inflammatory or degenerative rheumatic disease. يعني صرف البيروكسيكام لازم يكون تحت إشراف أخصائي مختص بالأمراض المفاصل والريماتويد، ولازم يكون البيروكسيكام should be used as a first-line treatment in adult and should be limited to the symptomatic relief of osteoarthritis, rheumatic arthritis, and ankylosing spondylitis في حالات معينة. And those should be not exceeded 20 mg per day and should no longer be used for treatment of acute painful and inflammatory condition. Treatment should be reviewed after 2 weeks after initiating piroxicam and periodically thereafter. Concomitant administration of a gastroprotective agent should be considered. يعني مع استخدام البيروكسيكام يفضل أن يستخدم gastroprotective drug مثل omeprazole, rabeprazole أو any other proton pump inhibitor. Topical preparation containing piroxicam are not affected by this restriction. إذن هذه تتبع use of capsule of piroxicam، يعني topical preparation ما راح تتأثر بهاي restrictions بهذه التحديدات. Contraindication with any patient to have a history of GIT bleeding. Use with caution نفس هاي الحالات اللي ذكرناها سابقا. تقريبا النون ستيرويدال كلها تتشارك بالcontraindication والcaution والside effect. Caution بالpatient with allergic disorder, cardiac disorder or connective tissue disorders. Avoid topical use, avoid contact with eyes and avoid contact with the mucous membranes or inflamed or broken skin, and also not for use with occlusive dressing or topical application. Also topical application of large amount can result in a systemic effect like hypersensitivity or and asthma. Also renal diseases may also be reported. Side effect common or more common here GIT side effect and skin reaction. Also piroxicam have allergy and cross sensitivity with other non-steroidal drug. Also long treatment with piroxicam may reduce fertility in females. Also use of piroxicam during a pregnancy should be avoided unless the potential benefit outweighs the risk. While in topical use, also have a warning of using of piroxicam during pregnancy also should be avoided. With breastfeeding, use with caution. Hepatic impairment with oral use of piroxicam, manufacturer advise caution. Renal impairment with systemic use, avoid if possible or use with caution. For topical use, deterioration in renal function has also been reported after topical use. Dose adjustment with systemic use, use the lowest effective dose with shortest possible duration of treatment. Also monitoring for renal function test should be considered. Piroxicam oral dispersible tablet can be taken by placing on the tongue and allowing to dissolve or by swallowing. For topical preparation apply with gentle massage only، يعني استخدم طبقة رقيقة منه إذا استخدمته بشكل topically على الجلد. أما الأورال dispersible tablet مجرد ما يخلي الحبة في فمه فهي مجرد راح تذوب أو راح تمتص أو حتى يبلعها بشكل سريع. Patient and care advice for topical preparation. Patients and their carrier should be advised to wash hand immediately after use. Piroxicam cause photosensitivity with topical use. هنا البيشنت لازم يحافظ على بشرته باستخدام السان سكرين وما يعرض نفسه إلى أشعة الشمس المباشرة أو أي مصدر للضوء، وكبسول بتراكيز 10 و20 ملغرام. Now we will talk about COX-2 inhibitors اللي هو etoricoxib. هذا selective COX-2 inhibitor. Indication and dose: pain and inflammation in osteoarthritis. Use in a dose of 30 mg once daily and may be increased to 60 mg once daily if necessary. Also use treatment for pain and inflammation in rheumatoid arthritis and ankylosing spondylitis. Maximum 60 mg per day. And in special cases may be increased to 90 mg per day. Treatment also used in treatment of acute gout. Contraindicated with treatment of active GIT bleeding, active GIT ulceration, cerebrovascular disease, inflammatory bowel disease, ischemic disease, mild to severe heart failure, and peripheral arterial diseases, or uncontrolled hypertension. Used with caution in allergic disorder, cardiac problems, coagulation defects, connective tissue disorders, Crohn's disease, dehydration, or use in elderly or history of cardiac failure. Also should be used in caution with patients suffering from hypertension or left ventricular dysfunction, edema, or risk factor for cerebral events. Ulcerative colitis also may be exacerbated. Side effects, common or very common: arrhythmia, asthenia, bronchospasm, constipation, diarrhea, dizziness, fluid retention, GIT discomfort. Also هو صح selective COX-2 inhibitor بس may cause GIT discomfort or GIT disorders. يعني still ممكن يسوي headache, hypertension or increased risk for infection, nausea or skin reaction or oral ulceration. ممكن أي side effect من ذولا وممكن عدة حالات من عندهم. Contraindicated in patient with a history or hypersensitivity to aspirin or any other non-steroidal drugs. Also long-term use may reduce female fertility. Manufacturer advise avoided during pregnancy because it is teratogenic. And in breastfeeding, use with caution. Manufacturer advise use with caution in patient with hepatic mild to moderate impairment and avoid in severe cases. Dose adjustment: maximum 60 mg once daily in mild impairment and maximum 30 mg in moderate impairment, and avoid in severe cases. While in renal impairment, avoid if possible or use with caution. If adults have estimated GFR less than 30, should be avoided. If children have estimated GFR less than 30, also should be avoided. Dose adjustment: the lowest effective dose should be used with the lowest or shortest duration of treatment. Monitoring for renal function tests should be considered. Monitoring requirement: monitor blood pressure before treatment and also for 2 weeks after initiation and periodically during treatment. Etoricoxib as a medicinal forms توفر بشكل تابلت بتراكيز 30 60 و90 و120 ملغ. نشكر حسن استماعكم ونتمنى لكم التوفيق، ونتمنى من حضراتكم ترجعون للBNF تقرون معلومات. هي المادة من الBNF بس إذا حبيتوا تقرون معلومات أكثر ترجعون للBNF. الدراج interaction أيضا ترجعون بالأبندكس 1. نتمنى لكم موفقية وشكرا جزيلا.